Hi back, Katie.
Hello, hello. I have a detailed question for you today.
Okay,
No,
look forward to it.
in the nitty-gritty, right? How does a person who has heavy periods? Does that
You
make
c-
sense?
you cut off for a second. Would you mind repeating
Oh,
the
oh, sorry.
question? So sorry.
But no, if she is a person who has heavy periods.
Okay. So because you cut off again, I'm going to try to sum it
Really?
up. We're so sorry, all these technical glitches and internet connections. How is a woman to know if she has heavy periods?
Yes.
Okay, awesome. Right. So yeah, it is a little bit difficult because everybody has a certain amount of blood loss, but the length and maybe the number of pads or tampons that a woman changes would kind of give that indication. If we are to use definition, a woman should have a period for about 3 to 5 days every cycle. Average cycle should be regular 28 days, 20 to 30 days. So the average blood loss amount is anywhere between 70 to 80 milliliters. But have you seen a woman that actually collects the blood and measures and sees if it's
Right.
70 or 80 milliliters? It's very difficult to assess that way,
Mm.
right? Unless you use a menstrual cup and you can kind of determine how much you have this day or with an exchange or something like that. Otherwise, women who experience heavy bleeds lasting anywhere between 3 to 7 days or longer, they're going to experience more frequent need to change either tampons or
Yeah.
pads or menstrual period, or maybe those underwear that kind of absorb the, I don't know what they're
Mm.
called, the menstrual flow.
Period panties. I've heard
There
them
you
called.
go. Okay,
Yeah.
sorry. I've never used them,
I
so
hate that word,
I really don't
panties.
know. Those women with heavy bleeds, so menorrhagia, excessive bleeding, would go up to 300 to even 400 milliliters of blood. So it's so
Oh,
difficult to quantify because if you drop 3 drops of blood in the toilet bowl, everything will turn red, right? So it's
yeah.
kind of hard to quantify that was a lot versus was a little. Some literature reports maybe 3 to 4 tablespoons of blood. It's very difficult to quantify. So generally speaking, if you use a pad, you should use maybe 3 to 4 pads in 24 hours. Now, those pads shouldn't be fully soaked to the point where you start having leaking. They should be just normal um, soaking. Can I
Yeah.
say that? Okay.
Mhm.
Tampons, if you use a regular tampon, maybe 6 tampons in 24 hours, and I'm trying to estimate here without having any kind of leaks. And if
Mhm.
you use Super Plus, maybe three or four tampons in 24 hours. Anything outside of that particular norm will put you at heavy bleeds.
Hmm.
Now, when you're bleeding for 7 days and
Yeah.
it's clotty and it's heavy and you have to go to the bathroom more frequently to either change or just make sure that you prevent any kind of leaking, that is also heavy bleeds. That's menorrhagia. Menometrorrhagia is when you have excessive bleeds, they long lasting, they're kind of irregular. So they're kind of come and go, but you're always dealt with the heavy amount of blood flow. That's when you lose iron, going back to that iron, right? And heavy bleeds are not normal. They are a vital sign, a trigger, a red flag that there is a hormonal imbalance, there's something going on in that background. Is it that you have endometriosis, right? Which would be you're more susceptible to estrogen growth. So you're growing that urine lining. You have maybe I think is embryonic development as well, tissue of uterine lining that has migrated outside of the uterus and is under the influence of the hormones with every cycle. So you would have that
Mhm.
abdominal bloating. Some women experience pneumothorax or bleeding, hemothorax, meaning blood accumulation outside of the lung lining between the chest wall and the blood, but because it is of migrated endometrial tissue that responds to the hormones with every cycle
Mm.
versus just hormonal imbalance. So simply taking the uterus out is not necessarily a quick and beneficial remedy. I don't really recommend that. I know there is kind of like a knee-jerk reflex, or they do ablation just to stop the bleeds, but they don't look at what is underground. Is there inflammation, right? Is there gut dysfunction? Are you not properly detoxifying that estrogen that would help decrease those heavy bleeds? Maybe you don't have enough progesterone support. Maybe you haven't ovulated that cycle, and that's the reason why you're under the influence of strong estrogen stimulating growth effects. So
Okay.
3 to 5 days, normal flow, no clots. When you start having clots, there's a trigger for something going on in the background. So seek medical help, because there's no one diagnosis or one cookie cut recipe for everyone who presents with these symptoms. The root causes could be completely different.
Okay. Well, that answers that. Thank you very much.
Or maybe start measuring the flow and see if you get to the 400
Uh,
ml. Don't do
I
that.
do use a cup normally, and I haven't this cycle, and so I'm like, oh, I have heavy bleeds. Oh my gosh, because I'm just crushing these tampons. But really, I underestimated how helpful my cup is. I'm like, changing a tampon 3 times a day? That's ridiculous.
Yeah, the
Maybe not.
menstrual cup is very good. If placed
Yeah.
correctly and a woman understands how to place it, it's a lifesaver,
I love it.
with no leaks, with no issues, nothing to worry about. So,
And it's not wasteful.
and it's economical and green, right?
Indeed.
We don't have
Awesome.
to
Well,
throw
thank
anything
you.
away. We don't have to recycle. It's just wash
Right.
and carry. So, yep,
Right. Yeah, it's true. I have a little carrying pouch for mine. It's quite cute. It's purple.
awesome.
Awesome. Well, thank you. This was a great video. I appreciate it.
My pleasure.
Yeah,
On to the
sounds
next
good.
episode.
Okay, bye.